At 66 years old, Paula Christo-Delitas is a mother again, this time to her two grandkids, Jaden and Madison.
They are very sweet, very intelligent, but full of energy.
She and her husband adopted them after her daughter was found unfit to be a parent. Approximately 2% of American children are raised by their grandparents.
It's difficult because you're starting over again. But the fact that they went to school, you had 8 hours on your own to do things. You have free time. Now, not only you don't have free time, you have to be constantly with them.
Paula's grandkids and nearly 3 million others in a similar situation are facing educational issues because of the coronavirus pandemic.
Jaden should have been attending WJPS full-time this year, but now the burden of education is on his remote teachers and his grandmother.
On the beginning, I was having nightmares, of course, of how to teach them, how to help them, how to learn the system. I would go to bed and I would go classroom. It was in my head.
There's also evidence these children may need extra educational and emotional support resources. A recent pediatric study showed kids who were raised by their grandparents were 5 times more likely to have experienced at least one adverse childhood experience. Dr. Andrew Addisman led the research.
Children being raised by their grandparents, there's a multitude of reasons. Unfortunately, none of them likely reflect happy stories.
The grandkids were 6 times more likely to have a parent in jail compared to kids raised by their parents. And they were 4 times more likely to have lived with someone with a substance abuse problem.
These are known to be risk factors of ADHD and many other things, and not surprisingly, there was a much higher prevalence of ADHD among the children who were being raised by their grandparents.
Paula's grandson Jaden has ADHD. The study grandkids were twice as likely to be diagnosed with the disorder.
He's active and he constantly has to be corrected on a lot of things, and it drains you out.
Paula decided on sending her grandkids to in-person classes part-time.
Both sides have negative parts and positives. Just sending them to school, you worry if they get sick. You keep them home, you worry about the emotional feelings.
She is more concerned about their well-being above her contracting the virus, even though she has ongoing health issues.
I'm not worried about getting it as much as I'm worried about them with the school. With the not get lost in the system, don't fall behind.
At first, Jaden wanted to stay home from school. Now he's happy to see his friends and teachers.
If I knew it was going to be this long and staying home all day, I wouldn't have been excited. I would have really wanted to go to school.
But it means Paula won't be able to see her son's family. Her daughter-in-law is pregnant, and they worry about the grandkids potentially spreading the virus.
There is a lot of issues with this. It's not just what's going on, it's what you have to face.
Sadly, Addisman believes more families may find themselves in Paula's situation.
Now with COVID, for example, taking parents in their 40s or 50s, it's one more factor that could potentially contribute to children needing to be raised by their grandparents.
For Cheddar, I'm Michelle Castillo.